15 costly errors people make with their end of life care. Frames the article as both a warning and a guide. It's just that many people unintentionally make choices or fail to make them that lead to unnecessary expenses, prolonged suffering, and emotional turmoil for families. The surrounding page content emphasizes that advanced planning is the antidote. It reduces medical costs, aligns care with personal values, and spares loved ones from painful, unnecessary procedures. What the page is saying in plain terms. Preparation is essential. Without written instructions or conversations, medical teams default to aggressive interventions that may not reflect a person's wishes. Family Families carry the burden when preferences aren't documented. Relatives are left to guess, often leading to conflict, guilt, or regrets. Few people plan ahead. Despite widespread awareness, only a small fraction of Americans have formalized their end of life choices in legal documents. The article is a call to action by listing 15 errors. It aims to transform vague awareness into specific corrective steps that readers can take now. Likely categories of costly errors. The introduction hints that the errors fall into several broad domains. Legal and administrative gaps. Not completing advance directives, living wills, or power of attorneys. Communication failures, avoiding conversations with family or doctors about values, fears, and treatment preferences. Medical defaults, allowing high cost and invasive treatments to proceed simply because no alternative plan is documented. Financial oversight, neglecting to coordinate medical wishes with insurance, estate planning, or long term care funding. Emotional avoidance, postponing discussions because they feel uncomfortable, which ultimately magnifies stress during crises. Practical steps. The page encourages documents your wishes clearly. Use advance directives or living wills to spell out treatment preferences. Designate a healthcare proxy Choose someone you trust to make decisions if you cannot. Normalize the conversation. Talk openly with family and clinicians about what matters most to you. Consider palliative and hospice care early. These services prioritize comfort and dignity, often reducing unnecessary interventions. Keep plans current. Review and update documents as health conditions or family circumstances evolve. Deeper implications. The article's framing highlights a paradox. While end of life care is one of the most predictable needs in healthcare, it remains one of the least planned. This lack of preparation drives up costs for the system, creates moral distress for families, and often results in care that undermines the patient's own values. By naming 15 costly errors, the piece underscores that these are not abstract policy issues. They are personal, preventable missteps that every household can address. Quick takeaway, folks. Okay. The surrounding page content makes clear that end of life care planning is not just about facing mortality, it's about protecting dignity, reducing financial strain, and easing the emotional load on loved ones. The article urges readers to act now, turning awareness into concrete steps that prevent the costly errors it outlines. Okay, guys, so that's your B for this afternoon. I will see everybody later for C. Until then, Gator Wellness, take care, folks.